My name is Dr. Dahianna Lopez, and I am an assistant professor at the University of Rhode Island College of Nursing. I received my PhD in health policy from Harvard University in 2016. My research focuses on efforts to prevent unintentional injuries. My pilot study, funded by the COBRE on opioids and overdose, begins to investigate opioid overdoses in motor vehicles, a growing concern in the field of impaired driving that has received little attention. Driving while under the influence of illegal drugs is a major cause of morbidity and mortality in the United States. Between 2006 and 2016, the percentage of fatally injured drivers who tested positive for drugs other than alcohol increased from 29 to 44%. In 2016, 1 out of every 5 drivers involved in a fatal car crash tested positive for opioids. Research has shown that drivers on prescription opioids are twice as likely as other drivers to be involved in a car crash and nearly 50% more likely to be held responsible for the crashes than other drivers. Furthermore, the emergence of extremely potent synthetic opioids into the illicit drug supply, like fentanyl, exacerbates the risk of loss of consciousness and overdose. Prior research has shown that motor vehicles as semi-public spaces are essential to many people's drug use routines. However, there is little research that contextualizes the occurrence of overdoses in motor vehicles. While media in the United States have reported on drivers discovered after an opioid overdose in parked or crash-involved motor vehicles, there are no published empirical studies on overdoses in motor vehicles to our knowledge. In addition, data on overdoses in motor vehicles are distributed across EMS and police datasets, which are generally incompatible. Our study will address this issue by linking police and EMS data and using text mining techniques to gain information on the social and microenvironmental conditions, such as whether the person overdosing was a driver or a passenger, the presence of other individuals in the vehicle at the time of the overdose, and whether other parties were involved, for example, other motorists if there was a crash. We have a social responsibility to investigate the veracity of the media's claims about the pervasiveness and nature of overdoses in motor vehicles, particularly if they are an undetected problem, and to identify spaces and places where interventions can be deployed in the future. Data from this pilot study will be used to identify specific prevention measures that reduce on-scene overdoses and arrests while optimizing road safety and treatment. This could save lives of drivers, passengers, and other motorists in the future.